Well, I'd like to welcome everyone to the City of Columbia's first virtual town hall. My name is Chaz Molder, and today and in the coming days, the City of Columbia is going to be proactive in bringing information to you as the community charts through this current pandemic and crisis together. We know that there is a lot of uncertainty out there right now and a lot of misinformation, so we're going to do our part to help bring clarity and information and comfort during a time of confusion and unrest. Through these virtual meetings and town halls, it is our hope that you'll become more aware of what's going on here on a local level. And in the spirit of a virtual town hall, perhaps it will also encourage you to start finding ways to communicate with your friends and family virtually. Today, we are very pleased to have joining us representatives from the Emory Regional Health System who will provide some very specific information regarding this virus, where we are, how we got here, and where we're going next. And I think that you're going to find this very informative. Let me also say that we're very grateful to all of our healthcare providers in Columbia and across Maury County, whether it be the private providers, whether it be the Maury County Health Department, and certainly the Emory Regional Health System, all of whom are working together to help us get through this crisis together. And indeed, Emory Regional Health System is a large component of that. Emory Regional has 360 inpatient beds, which makes it the largest health system between Nashville and Huntsville. It has over 200 physicians and over 2,000 employees who serve a region consisting of more than 250,000 people in southern Middle Tennessee. Certainly, Emory Regional is the hub for medical services in our region, and when we talk about assets in our community, in our own backyard, Emory Regional is always at the top of that list. So today I'm pleased to have joining me with this virtual town hall, Alan Watson, the CEO of Emory Regional Health System, and Dr. Deborah Goldsmith, the disease infection specialist for the system. Alan and Dr. Goldsmith, thanks for joining us.
Thanks for having us.
So first things first, Alan, moments ago, the Tennessee Department of Health released its updated numbers, and as of 2 o'clock on March 31, 2020, Tennessee now has over 2,200 cases, and Maury County has 11 confirmed cases. Alan, can you break down those numbers with how many tests have been given from the system or by the system, and how many positives, and why Emory Regional's numbers may be a little bit different from what we're seeing reported by the Tennessee Department of Health?
Sure. Because Emory Regional is not the only provider testing for COVID, the numbers that I will share with you are the numbers that we have tested within our health system. And when I report our numbers, these include patients who do not live in Maury County. Being a regional health system, we will treat patients from multiple counties in southern Middle Tennessee. And so the state numbers attribute positive cases to their county of residence. So for example, if Emory Regional Health tests a patient at Emory Regional Medical Center who lives in Giles, Lewis, Lawrence, or Wayne counties, etc., that positive is going to get attributed to the county of residence no matter where they were tested. But as of this morning, Emory Regional Health across all 3 hospitals and our employed physician groups have tested 417 people. We have had 15 positive results, 325 negative results, and we still have 77 that we are awaiting those results to return to our system so that we can contact those patients.
And Alan, on that note, do you want to speak to the fact that we are seeing the results turn back a little bit quicker than what we were seeing a week to 10 days ago?
That is correct. We found another lab provider who is turning results within, on average, about 48 to 72 hours. Early on, we are having results that were taking 7, 8, actually up to 10 days. And we still have some that were sent to those early providers that are in that longer time frame. But this new provider is turning results much more quickly for us, and that has been beneficial in that the negative patients that we have currently in isolation, we can get them out of isolation and stop using personal protective equipment that we can save for future COVID patients.
Obviously, the response time on those tests are very important, so it's good to hear that has improved significantly. Dr. Goldsmith, I want to turn to you now. What have we learned about COVID-19 and how quickly it is spread, and perhaps the demographics who may be at the greatest risk?
Well, I think most people know now that we do think it originated in China. We have many different kinds of coronavirus in the world. This is what's called a novel coronavirus because it came from animals into humans. And whenever you have that jump from one species to another, you just don't know how we as humans will react to it. We just don't have any immunity built up to it. We know it has spread across the world very quickly. I think the latest numbers were about 804,000 people around the world. And that's just representing the people who were ill enough to get tested. There are no doubt many millions of people who are positive around the world. It is spread primarily by droplets, which means when you cough or sneeze or spit, that goes out and people breathe that in. We do know, though, that there's a significant amount of what we call contact spread of it, which means those droplets that have the virus on them get onto the table, your drinking glass, wherever, and then we touch that. And it's not that it goes through your skin, that's not it at all, but once you have it on your hands, if you touch your eyes or your nose or your mouth, then you can spread it to yourself pretty easily, which is why we really push for people to not touch their faces. And I've alluded to this when we've talked before, how hard it is to not touch your face, particularly once we start talking about it. It's a very, very important part of prevention for people not to touch their face. Now, as far as risk, everybody is at risk of getting coronavirus. There is no age or no group of people that are immune to actually catching the infection, catching the virus and having infection. We know, though, that there are groups of people, if they do get infected, that statistically they do much worse, are much more likely to end up in the hospital, and in fact have higher rates of mortality as well. The main thing is age. Each decade from 60 years on up doubles your chance of death if you have COVID-19. Also, people with underlying health conditions, diabetes, hypertension, COPD, which is bad lung disease, anything that suppresses your immune system, all of those things put you at more risk if you do happen to get infected.
And on that note, with respect to testing, I know that there are certain CDC guidelines that must be followed with respect to whether or not you should receive a test or not. I know Emory Regional and other providers are following those guidelines. Can you tell us what those guidelines are with respect to who should be tested for the COVID-19?
Sure. First of all, let me say that I understand why everybody who has the sniffles wants to have a test. Everybody's very worried. We would all like to know. We don't want to be spreading the infection around to other people. So I completely get why everybody would want to have a test. It just isn't feasible. And it doesn't actually work with the science anyway. If people are without symptoms, there is no point in getting a test. It's not going to be helpful. It's not going to change anything that you do. If people are mildly symptomatic and really don't need to come in for medical care, we are asking them to shelter at home, to take care of their symptoms, taking Tylenol, taking showers, doing all the things you do when you just feel poorly, and not coming in to be seen. People who are feeling poorly enough that they need medical care certainly can talk to their provider or their urgent care, let them know that they're worried about having COVID, come on in and we will test. We give priority to people who are ill enough to be in the hospital, for sure. We test those people. People who are at particular risk for spreading to other folks in the community, like, for instance, if I started acting like I had COVID, we'd probably want to test me. I've been around a lot of people today. So we take those things into account, and the CDC actually prioritizes based on risk to the actual person of being infected, but also risk of them spreading to other people. If you think you may have had an exposure, you would think, I want to go and get tested right away. But if I get exposed today and I get tested tomorrow, that test is probably not going to be useful anyway. It's not going to tell you anything about whether or not that exposure led me to have any virus. It has to incubate a while.
You know, there have been a lot of different terms that have become part of sort of our daily life, social distancing being one of them. I'm sure we've all used that term more than a few times today. But there's been a new term that we've started hearing in the last couple of days, viral shedding, in the news. Can you explain what that term means and describe sort of how long that lasts?
Sure. First of all, it's probably going to make people not in the medical field very unhappy to realize that anytime anyone has a virus, whether it be a cold virus or COVID-19, that the virus is replicating in your nose or the back of your throat, and then it comes out of there again if you cough or sneeze or smooch with somebody, and that's shedding. That virus is shedding out of you. As the virus replicates, there is more and more of it. The virus wants to spread. That's how it spreads. So you are shedding it off. Think about you're shedding your clothes. You're shedding the virus out of your nose, out of your mouth. Now we know that people begin shedding COVID-19 virus about 24 to 48 hours prior to them feeling ill. So you might not even know you're sick, and you can be shedding virus and be able to infect other people. And that is part of the issue with social distancing. You don't know who's shedding. People don't know they're shedding. That happens before they're even having any symptoms. Now, how long do people have viral shedding? You know, most people, even if they're sick with it, within a week or so will be done shedding, but it looks like people up to about 14 days. If you get on the internet, you can find some cases of people who were shedding, i.e. still getting rid of some virus from their system, up to 30 days after their infection. That is highly unusual, though, usually within that 2-week point.
Well, it does seem that one of the scariest thing about this virus is that someone might have it and be asymptomatic, but then unintentionally spread it to someone else who has a significant medical condition that might have a much more severe prognosis with the virus. One more question for you, Dr. Goldsmith, before I jump back to Alan. We hear a lot of CDC guidelines and what you should do and what you shouldn't do. We hear about social distancing, which you've already touched on a little bit. What should we know? What are some of the main points that we should know as the public that we should be doing to prevent the spread of this virus here at home?
Well, I am going to go right back to social distancing because of that shedding, because people before they have symptoms can shed. We really need to stay as far away from each other as possible. That is social distancing. I mean, we talk about being 6 feet away because if I sneeze, my particles can go 3 to 6 feet away. That is where the 6 feet came from. But honestly, if you had a big party and everyone stood 6 feet away from each other, that doesn't mean that's necessarily a very safe practice because you're all milling around in the same air. So staying away from other people, staying within your family unit, the reason for that is so we're all not spreading it around without even realizing. And you touched on the idea that you might be shedding and not know it, or you might just not be very, very ill, but you could spread it to somebody who could have a lot of trouble. You could be young and healthy and have what seems like just a really bad cold, but you could give it to your grandma and she could die from it. And that is not just some crazy story. That is happening all over the world every day. For what it's worth, there are some young and healthy people without a lot of medical conditions who have still ended up very ill. So we need to social distance. We need to stay away from each other so we can prevent that spread. People who are able to stay at home, shelter in place, really need to do that. I mean, there are people who are essential workers who need to be there, and we all think about the hospital, but you know, we need to eat, we need groceries. There are people who, by nature of their job, the first responders out there, we don't have the luxury of staying at home. Everyone else needs to stay at home. You're staying at home to keep from giving things to other people, but you're also staying at home to keep from bringing things into your own household. It is the very most important part about this, is sheltering at home. And then if you have to be out and about for any reason, trying to keep that 6-foot distance from people and being really vigilant about hand washing. If you have to be out and about, if you go to the grocery store, stay away from people, wash your hands. I would be washing before I even get all the way into my car.
Yeah, certainly the medical personnel and providers have become the heroes during this crisis. And there's been a lot of photos and articles that you've seen on the internet that the medical providers are the ones that are saying stay at home. And so for the sake of folks like you, Dr. Goldsmith, and the medical staff and the administrative staff of Emory Regional, if you're saying that, then certainly it seems to me that we should all take heed of that. Alan, let me jump back to you now. We've been in touch on a daily basis, just talking about things that your health system is doing to prevent the spread. So just provide you an opportunity to outline some of the steps that the hospital has taken to prevent the spread at its facilities from a preparation standpoint, but also visitation we know has been cut down, and other things that you're doing, video visits, telemedicine, and that sort of thing, so that people still have access to your system.
Yes, one of the first things that most hospitals across the country implemented, and we followed suit, is to limit visitors to our facility. We did not want those folks bringing the virus inside our four walls and infecting our staff and our existing patients, even if they were asymptomatic. As Dr. Goldsmith stated earlier, there was always that possibility of transmitting the virus. The first step was actually limited visitors, but as this thing has escalated, we've actually gone to no visitors except in limited circumstances. Death, birth, and those types of things. So we've gone to very limited visitation, not only within the hospital, but at our clinics as well. We're also screening everyone that does come in our doors, patients and any visitors that are allowed, to make sure they don't have any of the symptoms that we would be watching for that could result in the spread of the virus inside our four walls. We've also stopped performing non-elective surgeries, things that can be put off for a period of time. We did that for two reasons. One was to prevent folks from bringing the virus into the organization. But two, we needed to conserve our masks, our gowns, and the personal protective equipment that our staff so greatly depend upon in case there is a surge of patients. We're going to be burning through the use of that equipment at a rapid rate. And so we've been trying to preserve as much of that as we can, so that if we get to the point of a surge of patients, we have the equipment we need to take care of patients the way we should. You mentioned our video visits. Our primary care physicians and other physicians in our network are actually now using video for those patients who don't need to be seen face to face. That does a couple of things. It protects a lot of our chronic illness patients from exposure to virus in the offices should they come in contact with someone that would spread that. And it allows our physicians to keep from being infected by patients who may not be ill enough for urgent care or emergent care, but could stay home and be treated virtually as well. You know, virtual visits is something that we have seen as a value to patients even prior to this situation. And I think the COVID-19 epidemic has shine the light on how valuable virtual visits are going to be, not only now, but in the future. And then in general, we have prepared plans on how we're going to staff if we have a surge of patients, where are we going to place those patients, and just in general, how we're going to take care of an extraordinary amount of patients, like we have seen in New York and others, should that come. We've talked frequently that we're preparing for the worst and praying for the best, and that's been the approach of our entire system throughout this event.
And Alan, sort of on that same note, one thing that we've talked a lot about is obviously Maury Regional is a health system located in Maury County in Columbia, and it's a very good health system at that for our own county. But in addition to our own county, as I mentioned at the top, it is sort of a hub for all of southern Middle Tennessee, and many of those neighboring counties are more rural than we are in Maury, and have less access to healthcare providers during an outbreak such as this. And so just wondering what you feel as though we are from a preparation standpoint, if in fact we start seeing cases continue to rise in the surrounding counties, that will then start leaning on Maury, specifically Maury Health System, Maury Regional Health System, for their medical services, and how we might be able to cope and handle inundation of patients from the surrounding counties.
I think we're prepared for that. Wayne Medical Center in Waynesboro and Marshall Medical Center in Lewisburg are part of our system. We have prepared them to take care of the patients that they can care for at that level. And then we're ready to accept those patients from those two hospitals, but from any of the hospitals in southern Middle Tennessee that have needs that they can't provide in those local facilities. Being a regional facility, we are looked upon to care for patients that are not appropriate in a smaller facility, and we're prepared for those patients before COVID, and we will continue to care for them after. Currently, we can care for over 300 patients within the four walls of the hospital as part of our surge plan, and we can go beyond that should we need to on this campus. So we are prepared.
Dr. Goldsmith, just to jump back to you briefly, I know a lot of people, as you sort of mentioned, has some concern about, well, if I feel like I have a cold coming on, or if I have a cough, should I call and see if I should get tested? If someone is exhibiting symptoms and thinks that they need to see a physician, what should they do? Should they call in advance before they arrive to their physician? I know that there's an information line that is staffed that Maury put out weeks ago, which, by the way, is 931-540-4257, which is available 12 hours a day. But what would your advice be, Dr. Goldsmith, to that patient that might think that they need to go see their physician?
First of all, thank you for posting that number. I didn't have it with me, and we need to have that out there. From 7 a.m. to 7 p.m., that is certainly a good place to call in and get a little guidance. But it is important, unless you are having a 911 type of emergency, to let any healthcare facility know that you're on the way in if you're worried that you might have COVID-19. Calling your physician or other provider's office to see if they're prepared to take you. Certainly our urgent care is prepared to see and screen people who may have COVID-19 and do whatever testing is appropriate. Our emergency department is as well, but again, we don't want people there unless they are having an emergency medical situation. If somebody was feeling ill enough to call 911, we would ask for them to tell the dispatcher that they're worried about that, because then the personnel coming to respond to the scene could wear appropriate protective equipment to avoid getting COVID-19 themselves. I think our first responders are at the very biggest risk of this, because they rush into situations to save life and limb, and they can be exposed to many different things over time. So it's important to let wherever you're going know. If for some reason you're just like at the front door and you haven't called, even if the very first thing you do when you walk in is grab a mask and say, I'm worried about this. That's very important for us to share that, to try to keep everybody safe. Just to let you know, the majority of people who are coming in, whether it be to their clinic or to urgent care, if they are appropriate for COVID testing, they're getting tested, but then they're given symptomatic relief and then they're going back home again. Most people do not need to be hospitalized. 80+% of people will be able to go home and to convalesce at home. So it's just important to know that coming in and being evaluated doesn't mean that you will necessarily be hospitalized, but you will be asked once you're home to be under self-quarantine until you are able to get your test results back. That means you can't stop at the grocery store or the pizza shop or anything on your way home from the urgent care. You need to go home and stay home. If you need people to deliver stuff to your front porch, then you need to do that. Many of us live in houses with other people, and that makes it a little harder. You know, how are you going to quarantine if you're all in the same house? There are recommendations that if you're able to within your household, be in a separate bedroom from other people, use a separate bathroom from other people, that would be best. That may or may not always be feasible. Everyone in the household needs to be super good about hand washing. You can't have your kids hanging all over you when you're home with your COVID infection or with your potential COVID infection. You know, many people were testing, they go home and they will end up being test negative. But while you're waiting, you need to be on self-quarantine. And that is part of being a good citizen in our community, not infecting other people.
Right. Well, Dr. Goldsmith, thank you for reminding us once again to go wash my hands. I can hardly wait for this to be over so I can go wash my hands. But since you reminded us to wash our hands, I'll remind everyone watching again that number, 931-540-4257. Again, that's a Emory Regional helpline that is staffed from 7 a.m. to 7 p.m. on a daily basis. And please do call that number if you have any questions whatsoever about this virus or about symptoms specifically. And Alan, I'll end with you. We talk a lot about how in this sort of moment that we're in, the best of humanity shines. And I know Emory Regional has been overwhelmed with best wishes and food being brought in to medical staff and masks being made to make sure that there's no shortage from a PPE perspective. We've seen a lot of that in the news as well. If I'm sitting at home and watching this, what can I do to help Emory Regional in its sort of efforts and initiative to help flatten the curve and to help get things back on track?
If folks will just go to our website, mauryregional.com, we have an entire section dedicated to COVID. And within that section, there are ways that you can help Emory Regional, particularly around masks, personal protective equipment, other things that I'm sure everyone is seeing on the news that are in short supply nationwide. And so we are very appreciative of our community. Our folks always rally together, no matter what the circumstances. And we've had such a great outpouring of support from our community. So MauryRegional.com, go to our COVID section, and there's plenty of information on how you can help. Also on our website in that section is the latest information that folks can get. There's so much misinformation in this age of social media. And we put out information that is based on CDC guidelines and the latest scientific information. And I would encourage folks to use that as a source, not the sometimes misinformation that gets shared through social media platforms. It's important to be educated, to know your sources and make sure they are accurate in the information they're preparing and sharing with you.
Well, that's a good point, Alan. You know, there is a lot of misinformation, a lot of rumors get started, a lot of, confusion, which that confusion leads to chaos. And so I think it is important for a takeaway from today for those watching is to follow MauryRegional.com or its social media platforms, and also even the City of Columbia and our social media platforms, which are basically pushing out the information that we're receiving from Emory Regional and or the Tennessee Department of Health. Because when you start paying attention to things that are not accurate or might not be, telling the whole truth, then that leads to more confusion and a lack of clarity. So thank you, Dr. Goldsmith and Alan Watson, for your time today. Y'all are at the front lines of this crisis here at home. And I know that while we're talking to the two of you here, y'all represent over 2,000 employees that are inside the walls of the various facilities of Emory Regional Health System on a daily basis. And I heard a lot of things medically today, Dr. Goldsmith, from you. One of the things I heard is that by socially distancing and taking the guidance from CDC seriously, that will help us flatten the curve, stop the virus, and importantly, it'll allow the medical professionals to do what they're trained and educated to do. So hopefully we'll all take heed of that very sound medical advice. And again, say thank you to Emory Regional Health System for being on the front lines of this crisis, and your leadership and commitments to our community and the overall well-being of the community. And so with that, I'll say to both of you, get back to work. And to those watching at home, I say thank you for watching and for rising to the occasion. As I said a week or so ago, I knew that this would be a challenge for our community. I knew that we would have to rise to the occasion, and I never doubted that we would rise. We're seeing it on a daily basis. People are staying at home. They are sheltering in place. They are social distancing. And you heard it from Dr. Goldsmith. That is the most important thing you can do for yourself and for others. Thanks so much for watching. We look forward to seeing you at the next virtual town hall. Take care of yourselves and stay socially distanced. Thank you so much.